Living with the coronavirus means trying to keep balance while getting pulled in opposite directions. There's a lot of that these days in Dorchester, whether it means supporting local businesses while keeping distance or learning while out of school. To bring us up to date is the managing editor and publisher of the Dorchester Reporter, Bill Forry. Thank you very much for joining us, Bill.
Hi, Chris. Good to see you.
I want to start with walking around the neighborhood. You're probably doing less of that, but what have you seen, especially as far as people observing the advice about keeping social distance?
For the most part, people are, Chris. There are people out walking around, walking their dogs, bicycling, obviously, going to supermarkets. It's a mixed bag. There are those who are very careful, I think, of watching their distance, and others who are walking in small groups. You presume and hope that those are people who are living together in a home and are socially distant outside of their home with everyone else. But clearly there are folks who, at least up till this past weekend, weren't getting that message. Mayor Walsh, as you know, was outspoken about that in a couple of his press conferences, really told people that they weren't listening closely enough, and he wanted them to get that message. He instructed his parks department to put up signage, which has now gone up in most city parks, instructing people not to play group sports. We were getting calls in here about teams practicing of groups of people kicking a ball around, which is just not a good idea right now. And the mayor reinforced that. They've actually tied up some of the basketball nets at city parks with zip ties. And so the mayor has said he doesn't want to have to do anything beyond that. He doesn't want to have to ban people from actually physically going into city parks. But, that could come if in fact, people aren't adhering to it.
Now, one of the things that is probably expected, and we'll see more of it probably with the surge later this month, is people going for health care at different places. Some of that's going to be at community health centers. Any idea of what you would expect in Dorchester?
Well, so far, when we're talking to the health center directors, they're telling us that they are seeing people coming in for testing. Most other patients who don't have symptoms of COVID, though, are staying away from the health centers, and that's a very smart idea, and it's following the guidance that the health center directors are telling their patients. They should be doing phone calls to their physicians or to their nurse practitioners at the health centers, calling ahead, making sure that any other scheduled appointments that can wait will wait until this is subsided. And really, people who have urgent needs are the ones who should be going to those health centers, but they too must call ahead. That's been the guidance now for the last 2 weeks. That really hasn't changed. We have seen, however, health centers like Harvard Street Neighborhood Health Center, whose director we talked to this week, they've converted some of their clinical space inside the health center to deal with COVID cases for testing purposes and for diagnostics. They're not there to treat people. Health centers are not equipped to treat people who have serious COVID symptoms. Those folks will be sent to hospitals. But they're really the front line in many cases in terms of testing and of dealing with folks who are trying to figure out if they have this illness or not. Kearney Hospital is the other major point in Dorchester where this is happening. They have been, as we've discussed, they've transitioned now to a COVID specialty hospital, essentially, and they will be doing testing right on site, actually outside the hospital in a tent that's set up. Councilor Tito Jackson, the former Boston City councilor, who was diagnosed earlier last month with COVID, was tested at Kearney Hospital. He described that as about a 15-minute procedure, and he got his results in about 3 days. Other people from not just Dorchester people, obviously, but throughout the community are using Kearney as a resource that way.
And I've noticed, of course, you have a tent outside the Codman Square Health Center, and it looks as if you have to go through there before you even have a chance to get inside.
That's right. That's a screening tent meant to keep people, meant to screen people before they go in the facility. If they do have symptoms, if they show, the symptoms of COVID-19, they'll be tested, and before they're allowed in the building, they want to know who's coming in. That's for visitors. Staff, I think, have a different protocol.
Now, of course, for health centers, and this is an issue raised by the Mass League of Community Health Centers recently, if they're putting off other appointments, they're losing revenue. And so I guess they have good reason to worry about that.
They do. Some of what's being done over the phone, Chris, is being covered. Some of the telehealth conferences that are happening online are, the governor directed that the state will honor some of that. However, there's large chunks. There's obviously a lot of missed appointments and delayed appointments that won't be part of their budget. It's a severe problem for community health centers. They've appealed to the governor to help them, and some of that's forthcoming. And then, of course, they're also dealing with the pressures that all health care workers are dealing with the shortage of protective equipment, and we're hearing that is becoming a more acute issue as each day progresses here.
I imagine these health centers would also be critical for immigrants or other people without insurance. They might feel more reluctant to go to a big hospital, at least at first. So I guess they're going to be an important part of the solution.
They're an important part of it. They really are a frontline function here in the city. And these are places that people are used to going to for their health care. It's where they go to get dental care and where they get their pediatrics and a whole range, as well as food pantries like at Dot House Health Center and Harvard Street Health Center and others. They operate food pantries that are really vital to folks who depend on it. They're continuing to operate, and they're asking for the community's help to help keep those going.
I want to turn to another crisis that's going on for many people because we're just past April 1st. The rent was due. A lot of people didn't have the money, and there was an effort at the State House to help them. Tell us a little bit about that.
Right. So both the House and the Senate have bills that have been introduced that would address essentially create a moratorium on foreclosures, evictions, late fees, etc., for homeowners and tenants, renters. Both of those bills are still pending as we speak today on Thursday, and they've been in development for the last week or two. On Tuesday, Senator Nick Collins told us here at the Reporter that the Senate bill had cleared a key hurdle with the Senate Ways and Means Committee, and that meant it would next go to the floor of the Senate for a vote, which was promising news on Tuesday. It's now Thursday. The Senate has not yet taken it up, but they're expected to. There is an appetite, according to Senator Collins, among the membership of the Senate and the House to get something done this week. Advocates are really urging them and the governor to get it done. Obviously, April 1st was a key date, but this is obviously an ongoing issue. This Senate bill, as it was written, would cover would basically offer protections to tenants and homeowners for the duration of the state of emergency, and would effectively give folks who have been directly impacted by COVID-19 related financial hardship, people who've lost their job or who've seen a reduction in hours that causes them to lose income. It would offer the entire population of the Commonwealth, not just people who are, for instance, have federally secured loans or public housing. This would be for folks, though, they'd have to show proof that they've lost income. So there are some mechanisms within the bill that would be restrictive, but it would offer a lot of people relief and protection at a time when a lot of us are feeling that vulnerability.
I noticed on your feed that one of the people supporting this was City Councilor Frank Baker. He represents District 3 in Dorchester. He was less enthused about an attempt to do this in a more symbolic way with a City Council resolution. How do you make sense out of that?
Well, look, you're right. Councilor Baker, two consecutive weeks, essentially was the lone voice against a resolution at the City Council brought forward by District 5 City Councilor Ricardo Arroyo that basically called for a complete moratorium on rent and mortgage payments and any penalties for not paying them. But it was a non-binding resolution, which Councilor Baker argued was somewhat moot. This is an issue that needs to be handled as the state legislature is attempting to, apparently, and the governor. It needs to be handled at the state level. Councilor Arroyo's argument is, look, all the voices of government should be stepping forward on this and making the case that this is an urgent need, and that resolution, even though it may have been symbolic in nature, was an important one to get across unanimously. Councilor Baker, I think, came down on the side of somewhat process on this and saying that, look, it's not in our purview, so we shouldn't even be talking about it. Big difference of opinion between Councilor Baker and all of his other colleagues on that one.
Well, speaking of symbolism in combination with substance, you have a very interesting person, an elementary school student in St. Brendan's School, and she's at work on her sewing machine. Gabby Arica, tell us about her.
Right, Gabby has really become a bit kind of the face of the local response, the kind of cottage industry, homegrown response to this urgency that everybody feels about protecting our frontline healthcare workers and our first responders. Gabby is a 10-year-old fourth grader at St. Brendan's School. Her mom is a retired Boston police officer. Her dad is an active duty Boston police officer, very much part of the firmament of Boston's public safety line. And Gabby, and you may have seen her, some people may have noticed she was on MSNBC last night speaking to Lawrence O'Donnell, another Dorchester, St. Brendan's native, about her experience. She's been making masks, Chris. She's a seamstress in training, and has been, since she's been homebound with her parents, she's been making masks, sewing them in her own home, using supplies that she's accumulated as part of her hobby of doing it, and also having supplies donated to her. Boston police officers brought her a new supply of some elastic materials this past week. She's made, at last count, over 150 masks and counting.
Tonight I heard it was more than 800.
Wow, she's
I was astounded.
She's really something else, and a very impressive girl.
And she's not just making a pile. These masks are actually being used by people who need them. Isn't that true?
They are going out to people working in hospitals. They're going out to Boston police who are in need of them in their work as well. And she's going to continue at it. And she's really been, inspirational. There are other people doing this in their homes as well. City Councilor Anissa Asabi George was an early adapter of this. She has a small business she runs called the Stitch House on Dorchester Ave. She and a team of people have been leading online classes on how to do this. And I'd encourage people to check that out on Facebook. Councilor Asabi George has been posting about this quite a bit. And obviously you can read more about Gabby's work and her great story of her family at the reporter.news.com.
Finally, I have to admit that you're really fighting the odds by getting the paper out, not only online, but in print. There are businesses all over Dorchester doing things. So tell us how people can connect with both those businesses and keep them going, and the Dorchester Reporter.
Right, Chris, we've been doing a lot of our coverage has been focused on small businesses like ours they're trying to figure out what to do next and how to adapt day to day to what is really a moving target here on not only advisories from the state level and the governor and at the federal level. There's a lot of uncertainty, obviously, and people who run small businesses and people who work for them are trying to figure out day to day what it's going to mean. So this week we focused and we kind of did a deeper dive on the Ice Cream Smith, iconic Lower Mills small business that continues to churn out ice cream, something that people really want right now, comfort food, and they're delivering. And the Ice Cream Smith, Chris Skillen, his wife, Sarah Mabel Skillen, talked to us this week about how they're changing their business practices, how they're trying to keep their employees safe, but they're still making new flavors of ice cream, as is their tradition every April as they reopen.
So for more scoops, you got the Twitter feed and the website, right?
You can go to .news.com, or you can follow us on Twitter @.news.